Hello, everybody. Dr. Dietz from Discover Health Chiropractic here. And today I wanted to talk to you about shockwave therapy. This is a therapy that we allow in our office here. Help really speed up healing for people. It can help with a lot of different areas. It can also help with a lot of chronic pain, but also helps really just speed that healing process up and break down that scar tissue. So I'm going to explain a little bit about what shockwave is, give you a little quick idea of what it looks like to go through shockwave therapy here. So bear with me here as I go through this, getting my computer going here. So we're going to talk about shockwave here first. First things, shockwave has been around for a really long time, actually. Where it really started back in World War II. They started about underwater explosions. But that's fast forward, gone through what they use for kidney stones. The lithotripsy is what it's called, but actually using sound waves to break up those stones to help shrink them, if you will. So one of the things that they found out is that as this has progressed over time, now it can help actually use for soft tissue and bone now, and how it affects those too. And what they found out with shockwave, what it does is it's not a shock in any way. It's actually an acoustic wave. So it's a sound wave that's produced. So just like when you throw a stone in the water, it creates that ripple effect, that wave. So there's a sound wave that's going into your tissues, into your muscles, your skin. And what that does is how that affects the body and how it's able to respond to that. So it actually really helps speed up the healing process. And we get down to now up to the 2020s here, pretty much almost every major sports team has shockwave in their locker room and in their training room for their athletes to be using. And so it's something that we've integrated here in our office here. It really helps speed up the healing time for our patients so they get better faster. And we'll go through that a little bit here. And so what it does is, like says, that sound wave that's bringing through there, it triggers your body's natural healing. So that's a great thing. It's not putting anything in, it's not taking anything out of you, and there's no chemical interaction like that. It's actually literally a sound wave that's triggering that healing process. And so it's great at breaking down scar tissue. It helps a lot with chronic conditions like arthritis, things like that. But it can also help speed up that acute injury also. So no surgery, no medications, nothing like that. What it does is it puts that energy pulse goes in, and then what it's going to start doing is it triggers that response in there. So now it crosses this micro trauma. Just like if you're working out, you're lifting weights, you're causing micro trauma to those muscles. So now they're going to grow, they're going to come back, they're going to heal, and it's going to grow, and it's going to actually be stronger next time. Same type thing here. It's causing that micro trauma, and your body's responding to that stimulus. So again, we're not putting anything in, we're not taking anything out with that. So then it starts to get that increased blood flow, cellular activity. Then those stem cells start to come. So a lot of people have heard about stem cells more recently. What really helps to actually trigger that new response. So then it's actually creating those new cells. It's that healing response that's happening. It starts breaking down those collagen and building up appropriately. So instead of that scar tissue where it's thicker and doesn't work as well, and not as flexible, not as pliable, now this is what helps break that down and helps create that new tissue in there and actually finish that healing process. So a lot of times people don't really go from that injury full healing, and then it goes into a chronic stage. So this is what's really cutting that time down, and so you don't end up in that place. So yeah, 50% faster healing time. There's a lot of, we talk about pain reduction. So actually feeling better faster. So you're not in as much pain, and really increasing that mobility and getting those joints moving again here. So that's why we love it here in the office. It's been helping a lot of patients. And so it's a great option for a lot of people. Now ours, there's two different types of shockwave. The one that we have is called the radial. So it's spreading it out. Think of like a flashlight, that light beam is going out wider. That's the type we have. Another type is called the focus, where it's going the opposite, where it's pointing in. So the one we have, the radial, it's more broad that way. It actually can get up to 4 centimeters deep below the skin. So it can get pretty much through most of your tissue, through most of your arm or something like that. And it's measured in bar is what it is, but it's actually just the air pressure because there's a compressor in there, and that's what's making that to make that sound, that acoustic wave. Um, it's really great for trigger points. So it releases those tight muscles, so helping break that down. One of the first ones we did, I did on one shoulder on a patient, and her shoulder was so much more relaxed afterwards. So then we had to do the other one and to get to balance that back out because it just helped break down those adhesions, that muscle tissue. So help releasing that. It's great for like your fascia, so your more of your tendon type stuff, so like your plantar fasciitis, IT bands. Also really good for your tendons insertions, like a torn Achilles or patellar tendon, things like that. I've been actually using it on my. I have a torn meniscus in my knee, and I've been working on that. It's been helping. I've been doing great with that. Yeah, the whole goal is that I wouldn't even have to have surgery. That I'll be able to heal it enough. So that's what we're shooting for here. And I'll give you updates on what that looks like for me here too. But even to reduce cellulite. So as what it's supposed to can help with. So it's a great comprehensive treatment, get great results. It's pretty flexible, pretty easy to go through. As we go through it. So a lot of great, works great with chiropractic. Again, same philosophy goes right along with it. Again, we're not putting anything in, not taking anything out. It's actually just speeding up that healing process, helping it work a little bit faster. And this is working more on the soft tissue where as chiropractor, we're working on that joint and that nerve. And this is actually helping speed up that healing process with that. So it works hand in hand. All right, so skip ahead here. Actually, so what does decreasing that pain relief, but also increasing that speed, that healing time. When we talk about Shockwave versus most of your other treatments, we look at your conventional treatments, like your medications, your NSAIDs, your Tylenol, your Advil, stuff like that. There's actually long-term risks with that. It affects your gut, your kidneys, your liver, heart, and because there's a lot of problems with that. It is a chemical and it is toxic to your body, and can cause a bunch of issues down the road. So another one thing people do for their pain is cortisone injections. Now that can really add up too. You might get some temporary relief, you might not, but it can also damage that tissue instead of helping to repair it. It actually ends up causing a lot more damage in the long run for a lot of people. Surgery, there's always risk with surgery. Anytime they cut anything open, there's going to be a risk. It takes a long time to recover. Again, I've had knee surgery before. I don't want to go through that again. I'm trying to avoid that. And so help get me back on track before that. So we talked about what can be happened with it. It's very safe. It's very fast recovery and lasting results when we talk about Shockwave. Now, there's over 100 plus clinical studies since the 2000s here. Rotator cuff, it's huge for, like I said, Shockwave. It was able to 94% improvement versus just doing physical therapy alone for doing rotator cuff injuries. So where PT alone was only 60% improvement, where the Shockwave had 94.9%. So huge jump there. We talked about plantar fasciitis, 75% achieved that pain relief after 6 months by doing it. So great for those two things. It also works really good when we talk about a lot of others. So we talk about muscle and tendon. So we talk about plantar fasciitis, rotator cuff, golfer's elbow or tennis elbow. So that's that right here or right on the inside, depending on which one you're talking about. Also those muscle trigger points helps break down those. So it's really great for a lot of those things. So this is why I love this. It's been helping a lot of those patients kind of get through that part a lot faster and get back on the road to health here. So we talk about more of your joints, talk about arthritis. I have a lot of patients that are coming in with arthritis, from everything from something like almost like a trigger finger type stuff, working on their hand, to working the bigger joints like the knee or the shoulder, or even work on the spine. So it's really great with those type things. Helps get that moving again. Really great for post-surgical. I've had a couple that have come in because maybe they've had a surgery of some type and breaking up that scar tissue, and not just that what you see on the surface of the skin, but the deeper issues are where they had to cut open all those things. And that's all of that scar tissue, breaking them, get that good, more pliable, flexible tissue back like it's supposed to be. And so it's great with all those things. Like I said, you talk about knee osteoarthritis here. Here's another study showing 87% clinical effectiveness rate when we talk about. So really improving that also. Breaking down that scar tissue, 30 to 50% there. Increased reduction of the calcific plaque. And so really breaking down that So really allowing those joints to be able to move again that were getting really stiff and not being able to move, and actually causing pain with that here also. So it can help with that a lot. I talk about those acute injuries. And what's great for doing is when you have that acute injury, helping it get healed so it doesn't become a chronic issue. And that's especially what we see a lot more often when we see more of my older patients. They've had this issue and it's become a chronic issue over time because they've had this time for it to let it go. Over time, it gets worse and worse and worse, and now becomes this chronic issue that you're always dealing with, instead of that acute issue where it just happened and your body healed from it and then you never have to deal with it again. This is where we start seeing that later on in life a lot more. So the tissue repair process, kind of how it works is at that first, kind of like that first treatment, that first week. And this is a great thing about Shockwave too. It's only a treatment's like once a week for most people, every 5 to 7 days. So it's not right on top of each other. It's spread out because your body needs that time to heal in between. But that very first one, it's creating that neuro revascularization. So it's getting that blood flow to the area. And that's the side effect that you do see, if anything, is you might see your skin be a little red afterwards. That means that bring that blood flow to that area. So that's a really good sign, something we look for with that. Another might be a little sore afterwards, like your body starting that healing process. Those are really good responses that we look for from that. After the second to the fourth visits in there, that weeks 2 to 4, that's when we're starting seeing those growth factors skyrocket. And so that collagen synthesis, that's really accelerating. So it's bring that collagen in there. This is when that healing is really happening. Talking that 4 through 8, that's when there's more blood vessels are maturing. That tissue is remodeling. That scar tissue is breaking down now. Now it's starting to build that good, new, flexible, pliable tissue in there instead. And then we get into that 8 to 12. That's more of that continued healing. That now we're getting into more of the functional improvement. So now, by now we're starting to get things so that now it's not just, okay, you had an issue with the knee. Well, why did you have an issue with the knee? Is because it wasn't functioning like it was supposed to in the first place, and then that broke down. So now we're not just healing that area, but now we're getting it so now that it's functioning properly, now that it's working like that hinge is working like it's supposed to, and now they're having that range of motion like you should also. And so what it looks like, most are going to take like 5-10 minutes tops for most people, depending on the area, how big the area is, and how many pulses it needs. Like I said, should be mild to moderate discomfort. It should not be painful. We tell people that if you're feeling like more than a 6 level of pain, that we need to back that down. Or shut it down. That we don't want to ever get to that point of it. But it is not a spa treatment. It's not a massage. But you will be feeling something with that, but that's creating that. So after, like, we expect some soreness for that next 24, 48 hours or something, that's totally normal. Again, we're telling you did something, just like you had kind of like a good massage. It's almost like talking about massage. It's almost like having an hour-long massage in 8 minutes. It's really hitting it hard in there. So it's really working out. So a great thing, you're able to get right back into doing and almost your normal activities right away after that. So it's nothing that you really have to hold up a lot for. I do have a couple recommendations that I do have for you afterwards. And so, but I'll get into that in just a little bit. But first, just a kind of a treatment protocol. So depending on where you're at and what you need, most people are going to need somewhere between 4 to 12 sessions, about once a week. More chronic conditions are going to need more treatments, that 6 to 12 range. The newer injuries, the acute, are more like 4 to 6. So that's severe cases, that up to 12 kind of thing. They're going to be more on that higher side of that. Now, one of the ways we do this is when we're doing a trial for everybody. So you do that trial experience first, and you're able to see how that feels, what that's like. And we'll know pretty much right away after that first treatment, hey, is this something for you or not? Most people are going to feel better right away, or they're going to feel like, okay, you feel like something's going on, you're feeling a little different, it's feeling like it's healing, there's something going on there. That's all great. We know that's going to be really good for you. If after 24, 48 hours, you're not feeling any different at all, then this might not be for you. And so it's pretty easy to do that. So we'll walk through what that looks like here in just a little bit. But even before we get to that, I want to show you here what it actually looks like. So I'm going to flip over here. So if we go to here, I'm just going to kind of pan down to show you what the unit looks like here. So this is our Shockwave unit. This is the little gun-looking thing here. This is what that looks like. This is the Shockwave. This is the end where the acoustic wave is coming out here. So this is what's on your skin, like that. So we saw it like this, and it's going to be putting a pulse in there and making a sound, if you will. kind of almost like a clicking sound. And so it's nothing to be afraid of, nothing like that. But you're putting that impulse in there. We use some ultrasound gel we put on there just to actually help that work a little bit better with that. So that's what that looks like in that part. But so your response from that treatment, you're going to see a lot of pain reduction. Usually, that dense tissue starts to break down. So it helps a lot in that too. Now we talked about that tissue damage. Now, if there's not a lot of damage, it's going to heal a lot faster. The more damage there is, the more it's going to take, more work it's going to take. So when we look at this, when we do that trial on you, I want to see how you respond. If we're able to turn that, put more pressure on there with it, or turn up the hertz, the frequency on there, then we know that you're going to be able to handle more and that you're going to heal faster. So you'll need a lot less treatments, if you will. If you're very sensitive, not able to handle as much, so it's going to take more treatments to get through that. So that's kind of how we judge that with that, and how you respond to the care. Like I said, if more sensitive, it's going to need more, and more resilient, it will need less. So what that looks like based on that tolerance, like I just said. So it actually just works really good with everything else that we're doing here. Works good with your home care. Works good with your adjustments. It just helps everything work much better, faster. And that's why I'm really loving this. So one of the things that we do love, it also helps reduce those future problems. And research shown it's decreased that by up to 65%, which is huge when we talk about that, where it's decreasing that having to have that re-injury process. And so that's awesome. We don't want those, want to re-injure it. That's the last thing someone wants is have to do that again. So when we're doing this, we want to make sure that you're not taking any anti-inflammatory drugs, Tylenol, something like that, muscle relaxers before or right afterwards. We do want you to stay active. We do want you to make sure you're drinking plenty of water before and after. But those are the biggest things with that. We're talking about kind of treatment comparison. We talked about that cortisone shot. That's just one shot's going to cost $100, $300 easy. It may last a couple weeks to months, or it may not feel anything different at all. But then you have the side effects with that. Physical therapy, that's going to cost you easily over $1,000. It depends on how much treatment you need, how many times you need to go in. That $1,000 to $4,000 it can cost up to a lot of times, depending on what you need. Now, Shockwave, we're looking at that's more like $200 to $400, $200 to $800, somewhere in that range here. So not near as much of that cost, but it doesn't have any of those side effects with it here also. So what we do here in the office, I'll do a $59 consultation and treatment session. So what that means is $59, that covers your exam, a consultation with me. If I even need to take x-rays of this area because we haven't ever looked at it before, that's all in that first treatment. That's all included in that. So if that's something that you are interested in, we do have, all you need to do is text TRY to the office, TRY to the office here. And you can do that, and I'll put that across here. So yeah, just text that to the office number, and I will be able to get you signed up for that right away. If that's something that you're interested in, get you in, get that trial, see if that, how you respond to that, and can show you what that looks like for treatment for you, if that's something you want to work on. Now, this is, like I said, this is great for shoulders, rotator cuff issues, golfer's elbow issues, carpal tunnel. So it's really great for all those things. Good for that arthritis in the hands here too. Another thing it's really good for, like knee issues, plantar fasciitis, and those really tight muscles that we can't get to relax. Those are really great for that, whether it be your calves or your traps, something like that. These are the things that you should definitely consider using it for. Great help in all those areas. But again, this is one of the therapies that we offer here in the office. It's called Shockwave. If you'd like to give it a try or find out more information, I'll just text the office 319-393-1555, and we'll get you set up for that. And I'll be able to handle answer any questions you have about Shockwave or what that would look like for you. But thanks so much for watching this, and hope to see you guys all soon. Have a great day.